Check, check, 1, 2.
All right, build a wall. Build a wall between our people and disease. That's what we do.
If you have a box, please go ahead and set the box next to the other boxes. It is not rocket science, it's just science activism, and I believe in us. How is everyone feeling? Yeah? It's fun to protest, isn't it? It's not that scary, is it? No? Nobody got arrested yet? If you have a box, please take it to this side of the box wall. You can set that just right there, yeah. Over here. If you have boxes, bring them over here. Let's go up. Let's build it up. I was going to say build a wall, but maybe we shouldn't invoke that today.
A wall against disease and disability instead of a wall against the neighbor.
Yeah, right? Like a wall against polio. Woo.
Hey, Bob, turn that box.
Build the wall. I'm telling you, I've got a career in late night comedy if this whole science activism thing doesn't work out. We're going up. Build the wall. Build the wall. Build the wall. Who says scientists aren't funny? I think we're funny. Do we have any more boxes in the audience? If you have boxes, go ahead and bring them up over here. Let's wave hi to all of our friends at HHS. Hi, lovely scientists. We love you so much. Thank you for the work you do. We're sorry your boss sucks. Could we make this a little more symmetrical? I'm sorry. Over. It occurs to me that we may have some missing boxes. If you have a box out there, please bring it over and build the wall. Oh, okay, sorry. I've been told that I shouldn't say anything about build the wall. I'm sorry. I was just trying to have jokes. I'm sorry. That's a lot of signatures, you guys. Look what we did. And we're just getting started. Ho, ho. RFK has got to go. Hey, hey. Ho, ho. RFK has got to go. Hey, hey. Ho, ho. RFK has got to go. Hey, hey. Ho, ho. RFK has got to go. Hey, hey. Ho, ho. RFK has got to go. Hey, hey. Ho, ho. RFK has got to go. Hey, hey. Ho, ho. RFK has got to go. Hey, hey. Ho, ho. RFK has got to go. Hey, hey. Ho, ho. RFK has got to go. Hey, hey. Ho, ho. RFK has got to go. Hey, hey.
Like 5-ish minutes.
Okay, so let's do a fun little thing for some of our social media since we've got all of these cameras. Does anybody want to come up here and talk a little bit about why, or maybe I'll just walk around. What's a reason why you think RFK has to go? Come on, somebody jump in the water. Okay.
I gotta come over.
I'm sorry.
No, it's okay. RFK has got to go because he is not qualified for this position.
I'm going to have to agree with that, yeah. As a PhD candidate, I'm more qualified, which scares the hell out of me.
Hi, RFK should go because he has no idea nor trust the science.
Yeah, 100%. You gotta be into science to do this job. The bar is on the floor at this point, you guys.
RFK should go because kids are dying from measles under his watch.
Yeah, 100%. We eradicated that disease. Last time I checked, we didn't uneradicate it unless apparently we did. Anybody else over here? Ooh, I like this Fox Lies channel shirt. What about you? Why does RFK have to go? Sorry, you have to come here.
Because we need a war on cancer, not a war on our cities.
Hey, that's right. That's right. Why does RFK have to go?
Because he doesn't work on pollution, which is a big health problem in children.
Yeah, absolutely. 110%. Okay. Ooh, I love your Stand Up for Science shirt. Why does RFK have to go?
Because he's killing people.
That's a pretty damn good reason if I have to say so myself.
Don't lay down for science.
What was that?
You don't lay down for science.
You don't lay down for science, you stand up for science. Okay, you're hired. I'll bring you on the marketing team. Okay, HHS saves lives. Why does RFK have to go? We're going to go down the line.
Oh, because he's literally destroying the next generation of scientists by terminating many, many, many research training programs. Shame!
Shame! Yeah, 110%.
He's going to kill our children with his vaccine policies or the lack of policies.
Absolutely. That is not shame. Let's do that.
I was going to say almost the same thing. He's going to kill people like me with his vaccine policy.
Shame! We're glad you're here. We want you to stick around.
He's not qualified. He doesn't know anything about public health.
Yeah, that would be a good reason to not be in charge of Health and Human Services, right? Okay. Shame!
He doesn't know anything about the agencies he's in charge of.
Yeah, so that's another reason. Shame! I love your, this is great. And I love your, you get the whole thing, history size repeats itself. God, yikes. Okay, why does RFK Jr. have to go?
Because Tylenol did not give my children autism.
Because Tylenol did not give children autism, oh my God. Which also, by the way, he said himself, oh, we got a really good sign over here. Can we get some focus on the brainworm sign? This is amazing. The sign says, nom, 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 so nutty, and it's the brainworm in RFK's head. That's a really good one. And it's like beautifully done too. Look at that, art and science. We have fun together. Okay, who's got more reasons for why RFK Jr. has to go? Anybody over here? Why does he have to go? Miss Good Trouble?
Oh. My father was a doctor of biochemistry, so do I need to say any more?
No, I think you're good. That sums it right up. That sums it right up, science. All right, you guys, we're going to be getting started here in just a few minutes. For the first time in activist history, a program ran on time and we made it to our next location early. Woo! It's almost like a bunch of you guys like have clients and keep appointments on time or something like that for a job. All right, so I'm going to pass the mic off for just 1 second so we can keep things going. And the next person on the mic is going to be Joel. Here you go.
Thank you. How is everybody? All right.
I don't know if we're quite ready yet, so you burn some time.
Oh, okay.
Yeah.
Right.
Because we got Congress people who will be on time.
Cool.
Be there. Yeah.
Okay.
Yeah.
Hey, ho, ho. RFK has got to go.
Hey, hey. Ho, ho. RFK has got to go. Hey, hey.
Yeah, I guess so.
RFK has got to go. Hey, hey. Ho, ho. RFK has got to go. Hey, hey. Ho, ho. RFK has got to go. Hey, hey. Ho, ho. RFK has got to go. Hey, hey. Ho, ho.
All right. We're going to wait just a couple more minutes for some of our special guests to show up. So keep chanting, keep making sure that they hear you in there, that you stand with the workers here who are working hard, despite their boss. And we'll get started in just a minute. Thank you. Nope.
We're really good at emergency response.
They need us.
Yeah.
Everybody wave at the window.
I know.
Keep waving. Keep waving.
It turns you into a gate.
We see you.
Come on out, RFK.
Is he in there?
What do we want? Public health? What do we want it now? It never goes with me. Let's see.
We got an open slot if anybody wants to join us and speak.
Your boss sucks! Your boss sucks!
All right, that's
Your boss sucks!
Very mature.
Your boss sucks!
oh yeah.
That's okay. We got to bring it back.
Your boss sucks!
Are we waiting until 4:30?
I'm going to start in 1 minute.
1 minute. All right.
So we can just heckle for a while.
Looking for electeds? Yeah.
Perfect. Definitely share us a good job.
Good chance. Just say, hey, RFK's got to go.
Oh, you got one?
No, we should be hollering at him to come down and answer questions for us.
Oh.
Tell him as loud as you want. Do you think that he should come down and answer questions for us? Yeah! Come on down! Come on down, RFK! We got a few questions for you. Come on down, coward!
Keep hollering. Keep hollering. Let them hear you. Come on. Come on. All right.
Got it?
All right. Well, good afternoon, everybody. Thank you so much for joining us, for all the work that you all do, for coming over here from the APHA rally. Let's give it a round of applause for the APHA team for a great conference this week. Hats off to that, to all of them for some great work there. We are here today on behalf of medical professionals, public health experts, and people across the country who are deeply, deeply alarmed by the ongoing damage of RFK Jr. And that he is inflicting as Secretary of HHS, and the urgent need for accountability. My name is Joel Bryson. I am the Advocacy Director at the Committee to Protect Healthcare. We are proud to stand here today with experts and members of Congress who will be joining us shortly, who understand what's at stake. Every day, RFK Jr. remains in charge of HHS, and in that building right behind me, our public health institutions and patients' lives are put at risk. Together, we are mobilizing to protect our communities and restore trust in our health agencies. Today's March for Health and Science, the APHA rally earlier, and the delivery of over 100,000 signatures urging Congress to hold RFK Jr. accountable. This is just one step in sounding the alarm on this administration's assault on our health and well-being. But our advocacy must continue until responsible leadership is finally restored. Our first speaker today is Dr. Rob Davidson, emergency physician and executive director of the Committee to Protect Healthcare. Dr. Davidson has spent decades on the front lines of healthcare, both as a physician serving a rural community and now as a leader of a 50-state network of physician advocates. Give it a round of applause for Dr. Davidson.
All right, thanks everyone for being out here. I talked a little bit over at the rally, mostly as my position as a physician, and I kind of hold that dear to my heart. I've been doing that more than half my life, but really here to talk to you about sort of myself as the director of a group of doctors out there advocating every single day. The Committee to Protect Healthcare is a nationwide network of over 38,000 physicians fighting for equitable, quality, affordable healthcare that protects patients and saves lives. Yeah. Not a lot to ask for. We mobilize and train our fellow physicians to fight for policies that improve patient care, protect public health, and ensure access to essential services. But we also hold politicians accountable when they stand in the way of that progress. And we saw last night what happens when people mobilize and people hold politicians accountable. In New York, in Pennsylvania, in Virginia, in New Jersey, down in Georgia, the Public Service Commission. We see what happens when they screw around with our health, when they screw around with people's right to vote. That's why we're out here, because we know when we hold them accountable, we can achieve anything. We are not afraid to call politicians out when they put our patients at risk. So when politicians like Robert F. Kennedy Jr. do just that, we get loud. Get loud, everyone. Some of you might remember at the end of 2024 and the beginning of this year, as the Trump administration 2.0 was taking shape, over 22,000 physicians joined with our committee to say no to confirming RFK Jr. as Secretary of the Department of Health and Services. I actually thank Senator Markey over at the rally because he read out that document of 22,000 doctors on the Senate floor to show that physicians in this country did not support Bobby Kennedy running this department. And I think all of us here were prescient when we made that prediction way back when. And when the Senate chose to confirm him anyway, opening the door for him to throw the CDC and NIH into chaos, politicize the FDA, and spread his disinformation at the highest levels of government, we came again together to oppose his antics. As an organization, we organized thousands of physicians in a unified letter urging Congress to use their oversight power to investigate Robert F. Kennedy Jr. and his undermining of public health. And the Capitol's not too far, and we can tell Mike Johnson, bring Congress back to order, exercise your oversight responsibility, and hold this guy accountable for killing our patients. Because we are not going to stop until RFK Jr. is held accountable. Every day he's in charge of the Department of HHS poses more threats to patients like mine and to all Americans. I also host a podcast along with our Chief of Staff, Miles Baker, called Paging America. So if you're in the podcast, look it up, Paging America. And we explore the power, profits, and politics shaping healthcare. And why that's relevant to what we're doing here is that every week we record and release a new episode. And literally every week we have a new conspiracy theory or other concerning action from RFK Jr. to discuss. It's like this guy, you know, if it weren't so scary and destructive, it'd almost be humorous that he provides us with so much content in the ridiculous things that he does, from falsely claiming that Tylenol causes autism to firing the head of the CDC. It's headline after headline that represents real threats to public health day in and day out. Doctors like me see the impact he's having on our patients when they express hesitancy about getting a long-standing safe vaccine or ask nervous questions about whether circumcising their child will cause autism. I know all you primary care docs out there, you have 15 minutes with a patient and you're spending time talking about giving Tylenol to people's kids and the safety of things like circumcision. It's just devastating. And we worry that we're going to see the impact he's having on our public health infrastructure when we're facing our next pandemic and when our ghost of a CDC is not able to deal with it. That's why physicians need to keep speaking out until RFK Jr. resigns or is removed. Our patients' lives depend on it, and all of our lives may very well depend on it. Thank you very much. I'll give it back to our MC.
Thank you, Dr. Davidson. Really appreciate that. Next up, we will hear from Dr. Ian Morgan with the organization Save HHS. It is a group of HHS employees fighting to protect the mission and integrity of the Department of Health and Human Services. Dr. Morgan.
Thank you. When Robert F. Kennedy Jr. took office as Secretary of Health and Human Services, he made clear promises to the HHS workforce and to the American people. He promised to work with us to make America healthier. He promised to build a culture of openness and pride in public service. And he promised not to impose his own anti-science beliefs on the nation. 9 months later, those promises have all been broken. I stand before you today as an American and as a father-to-be. A father-to-be who was denied access to a COVID vaccine to protect my wife and our child. A father-to-be who watched his wife fall ill and feared for her and our child's health. A father-to-be who knows of other expectant mothers who are afraid to take even basic medication because of dangerous anti-science rhetoric that's coming from the top of HHS right there. I also stand before you today as an NIH scientist. And a steward of the NIH Fellows Union, UAW 2750, which represents more than 5,000 early career researchers across the NIH. I've seen firsthand how Secretary Kennedy has undermined the mission of HHS to protect and improve the health and well-being of the American people. In just 9 months, Secretary Kennedy has crippled the HHS workforce through illegal firings. He's continued to spread disinformation about vaccines. He's undermined and disparaged career experts, declaring that trusting experts is not a feature of science and democracy. And he's appointed partisan ideologues who have replaced evidence-based health policy with ideology. This has left Americans more fearful and less healthy. On top of all of this, on August 8th, a gunman fueled by anti-vaccine conspiracy theories and rhetoric, the same rhetoric being amplified by Secretary Kennedy and HHS leaders, fired nearly 500 bullets into CDC buildings, terrorizing HHS workers and killing Officer Rose, a husband, a father of 2, and a father who is expecting his 3rd child. That tragedy should have been a wake-up call, but even before Officer Rose's blood had dried, Secretary Kennedy and NIH Director Jay Bhattacharya were back talking to reporters, doing interviews, continuing to spread doubt about vaccines and blame public health officials, painting a target on HHS workers' backs. HHS workers are dedicated public servants. We serve under Democratic and Republican administrations alike, guided by science, not partisanship, not ideology. We take an oath to serve the Constitution and the American people, and that oath compels us to speak up when harm is being done. When the federal workforce is not safe, the American people are not safe. That's why in September, over 1,000 HHS employees in our personal time and our personal capacities signed the Save HHS letter together to say clearly with one voice, Secretary Kennedy is not fit to lead the HHS. Today, I've seen scientists, physicians, public health workers, human services workers, patients, advocates, and leaders unite behind a shared dream. A dream of a healthier, safer, stronger America. A dream of preventing the next pandemic and ending the epidemic of cancer. A dream of being able to tell patients we have treatments, we can help. A dream of helping families thrive in the face of hardship and hunger. A dream of a healthcare system that is affordable and accessible to all. That dream demands courage. Courage to stand up and speak out. And if there's one thing I've learned throughout all of this, it's this. Courage is contagious, and it's spreading.
Thank you, Dr. Morgan. Hey, hey, ho, ho, RFK has got to go. Hey, hey, ho, ho, RFK has got to go. Hey, hey, ho, ho, RFK has got to go. Hey, hey, ho, ho, RFK has got to go. All right. Next, I would like to welcome Dr. Bob Morris, an esteemed epidemiologist and a leader of the Science Accountability Institute.
Thank you. Got a duck on cue. We're here today because RFK Jr. has done something remarkable. He's managed to unite 15 organizations from across the spectrum of healthcare, science, and public health to insist that he has got to go. The demonization of the public health community is one of the greatest outrages perpetrated by MAGA and MAHA. I just spent 3 days with that community at the American Public Health Association meeting, and you would be hard-pressed to find a group of people more selfless or more devoted to serving the public good. On behalf of that community, both APHA and Defend Public Health have joined us to send a clear message today that RFK has got to go. Now, we all know that physicians tend to be too busy for politics, but Junior has brought them out in force today. Physicians for a Healthy Democracy and the Committee to Protect Healthcare were key organizers for this event. Physicians for a National Health Plan, the Committee to Protect Mental Health, Doctors for America, and the Venerable Physicians for Social Responsibility have joined them today, many taking a rare day off because they believe it's critical to stand together and say, RFK has got to go. Junior even brought out the people who make doctors possible. Nurses for America is here to say, RFK has got to go. Organizations that simply stand for truth and public good are here too. The Accountability Journalism Institute, which helped organize this event, MoveOn.org, Roots Action, and Free Speech for People have all united to demand RFK has got to go. So thank you, Junior. You have united us. We stand together because we care about our patients and our communities, because we care about the disadvantaged and the marginalized, because we care about the truth. And truth matters. In medicine and public health, when you get the truth wrong, people die. These boxes behind me contain 150,000 signatures calling for RFK to go. Those signers and their 15 organizations speak with one voice. And we are not done. We know this is a long fight. But do not underestimate us. We are tough, we are united, and we are just getting started. Thank you.
Thank you, Dr. Morris. It is now my distinct pleasure to invite Representative Kelly Morrison, a physician and U.S. Representative from Minnesota's 3rd Congressional District.
Thank you so much. Good afternoon, everyone. Thank you to Stand Up for Science and the Coalition of Public Health Groups and all of you for coming out today. I'm Congresswoman Kelly Morrison. I represent Minnesota's 3rd District, and I'm proud to be the first and only pro-choice OBGYN to ever serve in Congress. Also very proud to be a founding member of the Democratic Doctors Caucus. And I can tell you, as someone who has worked for over 20 years as a physician, I am compelled to begin by expressing my profound gratitude to the public health professionals here today and to the many others who are serving in communities across our country. Your resilience in the face of intensifying attacks over the last months are truly a testament to your dedication and your resiliency. Public health is the backbone of our healthcare system. Public health has saved countless lives through transformative initiatives like vaccines, like car safety campaigns, like tobacco prevention campaigns. It's delivered improvements in maternal and child health, cleaner air, historic declines in tobacco use, and so much more. This is absolutely a critical moment for public health in our country. RFK Jr. has literally been singularly focused on orchestrating the destruction of public health in the United States. He has decimated the public health workforce through illegal firings and devastating funding cuts, and he has peddled his anti-science ideology in direct contradiction to evidence-based research. Secretary Kennedy's policies have been cruel and they have been wasteful. Under his leadership, HHS has fired, then rehired people multiple times over, canceled studies he himself later admitted should not have been cut. He has repeatedly demonstrated how terrifyingly unqualified he is for this role. And to make matters worse, the congressional Republican majority has refused to stand up for science, for the people that they represent, and for the safety of the American people. Shame is right. RFK Jr.'s carelessness and Republican complacency have jeopardized patient lives, scientific breakthroughs, critical research, and a generation of talented and dedicated workforce that every single American depends on. The chaos and instability that RFK Jr. and the Trump administration have created threatens America's health, leadership, and national security. They've twisted valid concerns that people have and sincere hopes for a healthier America into harmful policies that endanger our nation's health. When I embarked on my career as a doctor, I took an oath to do no harm and to protect my patients. When I was sworn in as a member of Congress, I took an oath to uphold the Constitution. I am bound by both of those oaths to stand here with you today and once again call on RFK Jr. to do the right thing for the American people and resign. I don't know who's next.
Thank you so much. Thank you so much. Let's hear it again for Representative Morrison. Awesome. All right. Great. Well, next up, again, it is my distinct pleasure to introduce Representative Herb Conaway from New Jersey, a physician, lawyer, and longtime champion for patient care. Thank you so much for being here.
My pleasure. I guess I shouldn't say my pleasure, because we are watching with this administration and with RFK Jr., a rolling disaster for public health and the health care of American people. Everywhere you turn, he's doing something that damages public health. Now, I came to the Congress after serving as a county health officer. And so, nothing like timing, Conaway. I went to that job as right just before the pandemic. And I can tell you how important it was for us and for the nation to have a CDC scientists who were making decisions based on the best evidence available to them, transferring that information down to the state and to the county level so that we could deliver the messaging to people about vaccines, about protecting themselves before the vaccines came, and all of the other things that we needed to do to protect ourselves from a pandemic that killed millions across the world. Now, so the CDC is critical, and I know that firsthand. The families in my district in New Jersey and Burlington County where I worked, they know that firsthand, and the American people are coming to understand just how tragic this administration is with respect to their health. First of all, and the litany is long, the biggest cut to health insurance and health care in the nation's history. Unmatched. $1 trillion out of Medicaid, $536 billion out of Medicare, hundreds of billions of dollars out of the premium tax credits that allow working families to purchase insurance. Everyone is hurt by this. And some people will say, well, if it's just Medicaid and we're not going after the poor people, that maybe that's okay. But and it's not. But everybody's insurance goes up. Everyone is impacted when Medicaid is cut. Why? Because hospitals depend on Medicaid to provide services. They depend on Medicare to provide services. If those are cut, what happens to services? They go down. What happens when people land in the hospital because they weren't able to afford to keep their insurance? We heard in our caucus just yesterday, if the premium tax credits are not renewed, 42% of people will decide they can no longer afford to be insured. But they're still going to go to the hospital. They're still going to land in a place where they're going to need care, and that care is going to be uncompensated, and that's going to negatively impact the ability of a hospital to stay viable. We're already seeing it all over the country. Nursing homes closing by the hundreds. Well, not yet, but it will be hundreds of nursing homes that close, hospitals that close, hundreds of them, and don't forget all all of the employees who work in healthcare? What will happen to the healthcare economy, which are people who are doing the security, people who are delivering food to rooms, people who are carting patients back and forth to rooms to x-ray, the doctors, the nurses, all impacted, all bringing down the healthcare of the American people. It is a disaster. And all because of this insatiable desire of the Republican Party to deliver the largest tax cut to the comfortable, the wealthy, the wealthiest people in the world. They're going to get a huge tax cut, and the American people are going to be strapped with $4 trillion in debt that people here, we've got some young people younger than me, certainly my children, grandchildren are going to have to pay. We can change that. Now, RFK Jr., you should understand. If you look at what's happening with the administration, it's all about the grift. RFK Jr. has made a bundle on stoking up fears about vaccines and public health. And he's doing the same thing in this position now. He is advancing junk science to justify his, I'll say non-science, I'll use the word irrational theories about how public health should run. He has changed his position on wearables and other things that benefit the people that he knows, fired people who know what they're doing in public health. I asked the question just this afternoon, are we going to be able to get people back? Are we going to be able to restore a CDC that has a forward lean on defending American healthcare? Now, we've got a flu season that's coming. This, with the shutdown, we're not gaining the information to make the vaccine for flu. Ordinarily, we get samples of about 10 or 12 different flu strains, and then we use that to make the vaccine to protect the American people. We're using half of that, and so of the number we need. And the reason they do it, just like the reason we're seeing all these cuts to government by the White House, they want the government to fail. They don't want the government to work. They want to be able to say, I alone can fix it by proving that government doesn't work. But we know how important the CDC is to protecting against measles outbreaks. They have impeded the ability of people to get measles vaccine when they need it to prevent and stop outbreaks. And who knows when the next outbreak's going to occur, and with the next child who dies who otherwise would be alive today for want of a vaccine because they've scared the living daylights out of parents who now decide to go without. That has got to end. He has got to go. Thank you for being here, for standing up for American health care and making sure that science is the basis of our decision making. Lies are always terrible because they distort reality and they distort the truth, not only in yourself, but in other people in society. And what you get are bad decisions. That's what happens when you live in an unreal world, where what you see does not match, or what you think is going on does not match the reality. This guy who's running this administration now, this department now, that's the world he lives in. He tells us so. And we need to believe him, and he needs to go. Bye-bye, RFK Jr. Get out. Resign. Thank you.
All right, thank you so much to Representative Conaway. Can we hear it again once more? Woo! All right. It is now my pleasure to introduce Congresswoman Maxine Dexter of Oregon, a physician and national leader protecting evidence-based health policy.
Good afternoon, everybody. Thank you so much for being here. And thank you to Stand Up for Science and our public health groups who are all standing together in solidarity. I am Maxine Dexter. I am a mother, a physician, and very proud to represent Oregon's 3rd Congressional District. I'm also one of the founding members of the Democratic Doctors Caucus. And I'm going to do what Kelly did because I can't lean over and read. So, like every clinician and public health worker here today, I know one simple truth. Science saves lives. Science gave us one of humanity's greatest achievements, and that is vaccines. In the last 50 years, the World Health Organization's global vaccine efforts have saved 154 million lives, including 146 million lives of children under 5. That's 6 lives saved every minute of every day for 5 decades straight. Vaccines don't just prevent death. They prevent suffering and billions in avoidable healthcare costs. We saw it all. I'm an ICU doctor. We saw it every day during the COVID pandemic. And then vaccines turned the tide. They saved lives in the midst of a deadly pandemic. They are the clearest example of what happens when science and compassion work together. Every single person alive today owes something to science. I love it. Yes, honk. Okay. And yet, the man leading our nation's health agency has spent decades undermining this exact science. Shame, shame. RFK Jr. has spread too many lies to count. Lies that vaccines cause autism. Lies that vaccines aren't effective. Lies that mRNA vaccines aren't safe. And then the irony is, when he wanted power, when he wanted to be put there by the people, he tried to bury those lies. During his confirmation hearings, get this, he promised he would, quote, do nothing as HH secretary that makes it difficult or discourages people from taking vaccines. Lies. He said that line 37 times in his Senate Finance confirmation hearing. But like so many other things he says, that was a lie. Earlier this year, he fired every member of the Advisory Committee on Immunization Practices and replaced them with vaccine skeptics. Shame. He pushed out CDC Director Susan Menares for defending evidence-based vaccine standards. Shame. He's canceled studies on mRNA vaccines and altered research priorities at our top research institutes. Shame. He has spent the entirety of his tenure as HHS secretary spewing misinformation, sometimes literally, and undermining public trust. And all of this is for what? So that he can peddle conspiracies and dehumanize people with autism. So yeah, as a physician, a mother, and someone who has dedicated my life to protecting human health, I cannot be silent while public health is dismantled. While trust in science is corroded, and while Americans' lives are put in danger. To lead our nation's health system, you have to stand on facts, on science and data, not lies, not conspiracies, and not ego. If you can't do that, you don't belong anywhere near the HHS. It's that simple, folks. RFK Jr. has got to go. So I'm calling on my Republican colleagues to find the courage to speak up and to stand up for science. Because everyone standing here today knows this fight isn't just about vaccines. It's about if we stand up for science, data, and compassion, or do we surrender to chaos, lies, and cruelty? I know where I stand. I stand with science, and I know you do too. I stand with truth, and I know you do too. And I stand with every American who refuses to be lied to. So now it is my great privilege to say that my mentor, champion for the state of Oregon, and Senator Ron Wyden, who from his perch on the Senate Finance Committee has led the charge to document and expose RFK Jr.'s deadly conspiracy.
I was told to come over here and get you worked up into a frenzy of excitement. But it sounds like we're already there because we're going to work till we fire RFK. I can't hear you firing RFK. I can almost hear you firing RFK. All right. Since day one, he's done nothing but sow confusion. Like Donald Trump, he fights people who can't fight back. He puts kids' lives in danger every single day. And so we're going to take a little poll. Every step of the way, Americans like you have stood up and said, no way. What'd you say?
No way!
I couldn't hear.
No way!
Okay, when he tried to support the cut of $1 trillion from Medicaid, what'd you say?
No way!
When he tried to fire the entire vaccine board and replace them with anti-vaccine radicals, I just want to guess what you said.
No way!
All right, we're sick and tired of being lied and misled by Robert Kennedy. This isn't right. And I want to close by way of saying we have a terrific woman in Oregon, Terry Mills, who is sending postcards everywhere. She is the bionic woman. She is doing a great job for science. And I just want to say, please, 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 all of us are here because we believe in you. We believe in science. But in order to get the value from science, we've got to fire RFK. Is it time?
Yeah!
I can't hear you. Is it time to fire RFK? Yeah! A little bit louder before I go. Is it time to fire him? Yeah! Onward to more science. God bless.
Thank you so much, Senator Wyden. Thank you to the representatives as well. It's now my honor to introduce Senator Chris Van Hollen to the stage.
Good to be here. Do we have any Marylanders in the house? All right. Any Virginians? Any great Washingtonians? And we need statehood and representation for the people of the District of Columbia. So it's great to be with all of you here standing up for science. You subscribe to the very radical idea that our healthcare policy should be based on evidence and facts and not politics, right? That's right, but we're dealing with an administration that does not believe in science. They've made that very loud and very clear. So we have to fight back every day. Are you willing to fight back every day? We are dealing with a Secretary of Health, that's what his title says, who is making people sicker in America. Are we going to stand for that? Hell no. Hell no. So I'm looking around this crowd, and I think I see a lot of mad scientists. Do we have a lot of mad scientists in the crowd? We all have a right to be mad. I am mad that we have a Trump administration and a Secretary of Health who spreads vicious conspiracy theories that kill people. Does that make you mad? Yes! We have a Secretary of Health and Human Services, at least that's his title, who has been shutting down and putting things in the way of clinical trials that save lives. When you put things in the way of clinical trials, you end up killing people. Does that make you mad? Yes! And then we've got a Secretary of Health and Human Services, at least that's the title, but he is fired people, illegally fired people at the NIH, at the Department of Health and Human Services, at the CDC, and other places. Does that make you mad? Yes! Yes, it does. So instead of firing hardworking folks at NIH and the CDC and HHS, we're here to say the person we need to fire is RFK Jr. So let me hear it. Hey, hey. RFK has got to go. Hey, hey. Ho, ho. RFK has got to go. Hey, hey. Ho, ho. RFK has got to go. Do we have any doctors? And I'm assuming in this crowd we've got a lot of folks who are involved in public health. How many of you are involved in public health? Thank you for what you do. And doctors and everybody involved in public health, nurses and all of you, subscribe to the Hippocratic Oath, which is do no harm. Do we agree that we should do no harm? Yes. Is RFK doing a whole lot of harm? Yes, he is, and that's why he needs to go. He needs to be fired. He was part of an administration that passed what they called the Big Beautiful Bill. This is a very, very beautiful bill if you're a billionaire. For the rest of us, it really sucks, because what they did was help finance those tax cuts for billionaires by cutting into health care for the American people, cutting Medicaid, cutting into other health care programs. And the result is that they are going to cause about 50,000 preventable deaths every year. Shame. And so, if you call yourself the Secretary of Health, it was his job to stand up and say, I'm not going to be part of an administration that supports a bill that provides billions of dollars in tax cuts to billionaires at the expense of everybody else and the expense of health care in America. But instead, he was a cheerleader for that. And he's a part of an administration that is attacking our democracy at its foundation, is attacking freedom of speech, is attacking due process. And this is an administration that wants all of you to shut up and go away. So I just ask you, are you going to shut up? No. Hell no. Are you going to go away? No. Are you going to say fire RFK? Hell yes. All right. Thank you all very much. RFK's got to go. Thank all of you for being part of this fight.
Thank you so much. Appreciate it. All right. Thank you so much to Senator Van Hollen. I'd now like to introduce Representative Mike Thompson from California's 4th District.
Thank you very, very much. Thank you all for being here. Chris Van Hollen. Give it up for Chris Van Hollen. Always been a leader for health care and good public policy, and always been able to detect when there's a rat in the house, and there's a rat in the house right now. Thank you for Stand Up for Science, for everything you do. Thank you all for being here today. And I just have to tell you one thing. I'm going to be real honest with you. Full disclosure. I believe in science. Do you believe in science? I'm the proud husband of a family nurse practitioner who goes to work every day and treats patients who need health care, who need her help, and who need good science. So I know firsthand, and I hear, believe me, she adheres to HIPAA, but I also hear every day how much this guy and this administration is scaring the hell out of patients across the great United States of America. It's unimaginable to me that someone can have this position when they don't believe in science, they don't know anything about science, they don't have a medical degree, they don't have health care experience, they don't have health research experience, and most important, they have no respect for science. He is scaring the American people. He is putting Americans at risk. He is putting the lives of Americans on the line every day. He is a train wreck. He is a danger, and we should all be outraged across the United States of America. Thank you for speaking up. And I just want to say, Senator Van Hollen was correct. How in the world could the Secretary of Health and Human Services stand by idly while this administration disassembles the delivery of health care to the American people? And that big, beautiful bill that Chris talked about? Yeah.
Let me tell you what it is. It's a big, ugly bill. That big, ugly bill takes $1 trillion out of health care. And that is something that is going to just unravel our health care delivery system in this country. Hospitals will close, clinics will close, skilled nursing facilities will close. The ones that stay open are going to have to fire people in order to keep their doors open. So this doesn't just touch people on Medicaid. This touches everybody, no matter how you get your health care. If you're rich, if you're one of those billionaires that they're screwing everybody else in order to give a tax cut to, it's going to hurt you too. Because if you show up at the hospital and you need health care, it doesn't matter how much money you have. If the health care provider you need to save your life loses their job to keep the hospital open, you're out of luck. This is one of the most evil budgets, one of the most evil pieces of legislation, one of the most dastardly legislative moves that we have ever seen in the history of our country. And to make it worse, it gives a tax cut to the richest people in the country and at the same time adds $5 trillion to our national debt. This administration is a disaster. This administration is a train wreck. And it's not just all of you here who understand that and agree with this. If there's any doubts, you can call the voters in Virginia. You can call the voters in New Jersey. You can call the voters in New York. Or you can call the voters in my state of California and ask them, just in case you haven't read the election results from yesterday. So we're all in good company. The majority of the people across our country understand that this administration is a train wreck. They understand that this secretary is a health care disaster and that we need to speak up, we need to stand up, and we need to demand that this guy be gone. So thank you very much for being here, and let's make America healthy again, and we can start by getting rid of this Secretary of Health, and we can get rid of this administration. We can get rid of the majorities over in that Capitol building, and we can return to sensible, honest, science-based public policy. Thank you all very much.
Thank you so much, sir. Thank you so much, Representative Thompson. We have one speaker left. I would love to introduce Colette Delawala, the founder of Stand Up for Science and a great leader in this movement to hold RFK Jr. accountable.
Hi, everyone. Thank you so much for coming out today. It is always a joy to be in coalition with groups that are thinking in the same direction that you are. And, it's just nice to get to see that we are not actually all crazy and there's other people who, agree with us. So as the congressman mentioned, last night was a referendum on Trump, on his policies, and on his people. And this is the start of our referendum on RFK Jr. That's right. As a mother and a scientist, I call on RFK Jr. to be removed from office for many reasons, for several reasons. This man is endangering my family by eliminating key offices that identify and address the spread of preventable illness. This leaves my family and your family at a greater risk of life-changing and deadly illnesses, even when we do everything right as individuals. As a mother, I have participated in the social contract with other families that we don't want to lose our children, and so we vaccinate them. That's the social contract. It's really simple. And I wouldn't wish child loss on my worst enemy. And so to be enacting policies that undo this very, very valuable social contract that has led us as a nation in my grandmother's lifetime from going from a 30% death rate of children who are born not making it to adulthood to over 98% of kids who are born making it to adulthood. That's because of modern medicine. It's incredible. I mean, the proof is in the pudding. Like, this is a non-starter, right? And so JFK, for no reason other than to harm families, other than to destroy this social contract, is tearing apart our public health systems. And I have some news for you. We have power. We have power. We saw it last night. We have power. Science is political. It's political. I know I don't have to convince all of you because you're here, but science is political and we have to get political. Science is political. I know it's a crazy thing to say, but like I tell people that and they're like, no, it's so scary. I'm like, I'm sorry, but science is political when evidence shows that meeting basic nutritional needs in kids supports their long-term well-being and Congress is stopping SNAP benefits. Boo, shame. That's shameful. It's shameful. Like, how are you going to make America healthy and starve kids at the same time? Explain that logic to me. I'm a scientist, but I don't get it. Science is political when the president writes executive orders incorrectly defining biological sex, thus creating a basis for policy that is unscientific. Shame, boo, stupid. Science is political when words are banned. When we ban words, we're being political. Science is political when Congress votes to appropriate federal funds to research and development. Science is political when the EPA rolls back policy that results in greater exposures to lead and asbestos despite scientific findings of harm. Shame. That's shameful. And science is political when this administration pushes rhetoric that one people group is genetically superior to another people group. That's when science is political. It is shameful. Today is the start, not the end point, the start of a very serious and united campaign to remove RFK Jr. from office. And I am asking you to get political with me. Will you get political with me? I said, will you get political with me? RFK has to go. He has to go. It is for our lives. This is a life-threatening person in office, and he has to go. So today is the start of a campaign that will not stop until he is gone. Thank you so much for being here today. Thank you so much.
All right, one more time so that they can hear you up there. Hey, hey, ho, ho, RFK has got to go. Hey, hey, ho, ho, RFK has got to go. Hey, hey, ho, ho, RFK has got to go. All right, and just in case they can't hear you through the glass, I brought my friend here to teach you all how to sign Fire RFK Now. Fire? Fire? Junior? Now. All right, everybody got that? Fire. R, F. Fire. R, F. K. Junior. Now. All right. Thank you. One more time. Yeah, thank you all. Thank you all so much for being here.